Hi, I'm Megan Farmer for the UAB Department of Genetics. Come with me while I talk to a patient about genetic testing and how it might be important for a patient's cancer treatment, prevention, early detection, or risk reduction. Then we'll talk about how this could be important not only for that patient, but their family members, and ultimately how we can work together with other doctors in the healthcare system. Good morning, Teresa.
Good morning.
I'm Megan Farmer. I'm a genetic counselor. Have you been told very much about what to expect today?
No, I haven't. I just found out that I had triple negative breast cancer, and I have 2 daughters, and I'm just concerned that they're at risk as well. So my doctor recommended me to come see you.
Okay, so it sounds like based on the conversation with them, you're not only thinking about how this might impact your treatment, but also how it might impact other family members.
Yes, correct.
And in genetics, we really think about the whole family, so you're in the right place. I'll be going over your medical history and your family history. We'll talk about whether there are any red flags that make us think there could have been a genetic reason for your cancer, meaning a hereditary condition that could be passed from one generation to the next and put somebody at an increased risk. We can talk about whether genetic testing is appropriate and which testing might be best, and then how that could impact not only your treatment plan, but how we could best take care of you in the future. And then also, of course, how it would impact other family members like your daughters.
Okay, so what is genetic testing and how is it done?
That's a great question. Genetic testing is usually just a blood test or a saliva test that can be done in the office today. I'll be the one to call you with your test results. So we'll have a conversation about exactly what it means for you and for your family, and then I'll also talk to your doctors so that we can kind of work together to come up with a customized plan for you.
Okay. How can you help me determine if my family members are at risk?
Okay. Well, first things would be to do just kind of look over your family and see if we are even suspicious that there could be a hereditary cause.
Okay.
You know, cancers are only due to a genetic condition about 5 to 10% of the time. So the first question is, are we even suspicious that that's what's going on? And then if we are, we'd move on to the next step, which is what condition are we most suspicious of and how do we test for that? So I understand you're 45 and you were just recently diagnosed with this triple negative breast cancer.
Yes.
So I would imagine you're pretty overwhelmed, and we're going to be adding more information to that today. So feel free to interrupt me if you have questions.
Okay.
I understand you haven't ever had any surgeries before this.
No, I have not.
So we're still coming up with your current treatment plan.
Yes.
And otherwise, you've been pretty healthy leading up to this.
Yes, I have.
Okay. So also maybe sort of a surprise for you to find yourself in this position. So we'll take good care of you.
Okay.
So looking at your family, thanks for filling that information out ahead of time. It gave me a really good head start. I understand you have 2 daughters, which you mentioned, and a younger sister and brother. They're all healthy. Your dad's never had cancer, but he had a sister that actually had breast cancer at 40 and at age 63. And then I understand your dad's mom had ovarian cancer at 59.
That's right.
Okay. So you can see cancer sort of clustering on that side of the family. What we look for when we're wondering if there could be a genetic reason for cancer are things like cancers at early ages, so breast cancer before the age of 45 or 50, and you would fall into that category. Even the type of breast cancer can make us suspicious sometimes, and we know triple negative breast cancers are more likely to have a genetic cause. We're more suspicious if we see the same type of cancer on the same side of the family and in multiple generations. So the fact that we see breast cancer in you and an aunt, and that her first breast cancer was at an early age, makes us a little bit suspicious. The fact that she had breast cancer 2 times, so it wasn't a breast cancer that spread or came back, but 2 separate breast cancers, that can be an indicator that there could be a genetic reason. And then lastly, it doesn't always have to be the exact same cancer on the same side of the family to be a genetic condition. We know some cancers can sort of be related. So we know breast cancer and ovarian cancer can fall under the umbrella of the same genetic condition. And in some families, even pancreatic cancer and melanoma. So those are the sort of things that I was looking for in your family. When we see all those things, we think of a condition called hereditary breast and ovarian cancer. So that's the condition that we're most suspicious of and we'll talk about in more detail.
Okay.
What questions do you have so far? Does that all make sense?
I don't have any questions at this time.
Okay. Then I have to take you back to high school biology for a minute.
Okay.
Were you a fan?
No.
That's the answer I usually get, so I'll try to make it as painless as possible.
Okay.
Our genetic information is basically our body's instructions. So it tells us how to grow and develop and function. And a gene is just a very specific piece of that genetic information. So every gene has a job. We have a whole group of genes that are good things. They're called tumor suppressor genes, and they protect us from developing cancer. And they do that by telling our cells not to grow and divide when they shouldn't, and not to go places they shouldn't go. Because that's what a cancer is. It's cells that have misbehaved and sort of gotten out of control. So that condition I was talking about, hereditary breast and ovarian cancer, it happens when genes called BRCA1 or BRCA2 aren't doing their job. So if you have genes that are supposed to protect you from developing cancer and they're not doing their job, you're going to be born sort of with your defenses down and be at an increased risk. And then if we can identify that genetic cause, we can also test other family members for it. So not only would we be diagnosing you, but we'd be figuring out what was going on in your family and then how to tell which relatives might be at risk and need closer care. What questions do you have about any of that? That was a lot of information in just a couple minutes.
I don't have any questions about that right now. It's a lot to digest. But I was wondering, is there a way where I can get more information so I can share this with my family members?
Absolutely.
And the rest of that?
So I'm going to send you home with some information that you can share with them. I'll also write a letter about today's visit that I'll send to you and to your doctor, just so you'll have it all to digest and read over. There's also a really good website. It's the National Society of Genetic Counseling website.
Okay.
That's our professional society, and it's www.nsgc.org. It's also a place where your family members can find a genetic counselor in their area.
Okay.
So that's probably a good place to start.
Well, I'm glad I came to talk to you today.
Absolutely.
You make me feel at ease.
Okay, good. I do want to talk just a little bit about how this could impact your treatment plan
Okay.
and your family members, because I know you said
Okay.
that was a concern.
Yes.
So if we do this genetic test and we do find that you have this condition, we'll know that it impacts your current plan and that it could put you at increased risk for a second breast cancer. So when your doctors talk to you about it, it might impact the surgery decisions that you guys make together.
Okay.
We also know that you'd be at increased risk for other cancers down the road, so things like ovarian cancer, possibly pancreatic cancer, or melanoma. It'd be also important for men in the family because we can see male breast cancer, and of course men can develop pancreatic cancer or melanoma or prostate cancer. So for both you and family members, if we know someone's at an increased risk for cancer, we either want to try to detect those cancers earlier when it's easier to treat them, or to try to reduce the risk altogether. And you'll talk to your doctors more about options to do that.
Okay.
So that'll kind of be step one. If you have this genetic condition, we suspect you inherited it from your father, given the family history of cancer on that side.
Okay.
And when someone has a condition like this, there's a 50% chance they'd pass it to each of their children. And given that we expect you inherited this from your father, we would have thought there'd be a 50% chance for him to pass it to each of his children. So this could be important not only for your daughters, but for your brother and sister, and then your relatives on that side of the family. So they can go back to that website you were asking about to find a genetic counselor and to get
Okay.
testing themselves. And it's sort of a ripple effect from there.
Okay.
Any other questions that you want to address today?
I don't have any at this time. I just want to go ahead and get the testing done.
Good. We'll get that set up today.
Okay.
Bottom line is that you could be at an increased risk for future cancers. This could give us an explanation for the history, but at that
Okay.
point we're armed with some really good information so that we can all be more proactive about your health. And then we're going to use that information to come up with a good plan for both you and your family.
Thank you so much.
You're welcome. Thanks for coming in. Only 5 to 10% of cancers are due to an underlying hereditary condition that's being passed from one generation to the next and significantly increasing someone's risk for cancer. Genetic counseling can be helpful because genetic counselors will review someone's medical and family histories to determine whether or not genetic testing might be appropriate. They'll look for red flags like cancers diagnosed at earlier ages, such as breast cancer or colon cancer diagnosed before the age of 50. They'll see if there are multiple family members on the same side of the family and in multiple generations that either have the same type of cancer or cancers that we know can be related. We also know that rare types of tumors or even someone's ethnic background can play a role in whether or not a cancer is more or less likely to be due to an underlying genetic condition. A physician or a patient can locate a genetic counselor by visiting the National Society of Genetic Counselors website at www.nsgc.org.